Now, we've been in lockdown for a month in this country. We're staying at home. We're doing our bit to help protect the NHS or flatten the curve, as they say. But there are some scientists now saying that nationwide quarantine has worked. It's been successful. They say we can be confident the peak of the virus in hospitals occurred 2 weeks ago on April the 8th, and the rate of infection peaked 21 days before that. So what does that mean for us in practice? Can we look forward to a lifting of restrictions soon? The government has been reluctant to even discuss an exit strategy, but Labour, under their new leader Keir Starmer, who's about to do his first Prime Minister's questions, saying, no, you can trust the public to discuss an exit strategy. It won't mean we all suddenly run out of our houses. Moreover, we know that the official daily death toll doesn't take into account deaths which occur outside hospitals. So there is a fuzziness there. But we'd love your thoughts on this. Are you thinking we've passed the peak, so we need now an exit strategy? Or is it too soon? Email vine@bbc.co.uk with your thoughts. And don't forget to include your phone number, please. And you can text us 88291. Let's talk about the numbers first with one of the best statisticians in the country, Professor Sir David Spiegelhalter at Cambridge University. Good afternoon.
Good afternoon.
So it looks, if we start with the death figures, it looks as if they have peaked, does it not?
Yes, you mentioned the daily figures that get reported every afternoon. I've almost stopped taking any notice of those because they oscillate wildly. There was a big spike yesterday, but there always is on Tuesdays because people send in their returns after the weekend. So what's better to look at is the data released by NHS England, who've got a spreadsheet, and they show actually the number of the actual date on which people died, and there's a clear peak of about 800 deaths on April the 8th. And since then, in English hospitals, there's been a steady, rather slow, but steady decline. Obviously, it wobbles up and down a bit, but it is steadily going down. And we're sort of following the pattern in Italy a couple of weeks previously, where it reached a maximum, and then it slowly declines. It doesn't go down as fast as it went up, unfortunately.
The really interesting thing here is if we look at the average length of the illness in a person who dies, they get 5 days where they've got it but they don't know, called incubation, 7 days where they're ill, 7 further days where they're iller, and then the last 7 days, sadly, they spend in hospital and they die. That's 26 days. Now, this peak, if the peak is April the 8th, that suggests that the most infections happened just before we went into the tight lockdown. In other words, we didn't need to do it because we managed to create a peak before then.
I don't agree with that. I think that, for a start, we just don't know what would have happened had we taken on a different policy. And the idea is, yes, certainly many of these people who are dying at that peak would have had their infections before. I think, with the numbers you quoted is one, there'll be a big spread all around that. But the crucial thing, I think, is that the measures which people were taking, largely voluntarily as well, people were really, acting with their feet in terms of, reducing their social interactions beforehand. I think that will have had an effect, and that might have sort of stopped us going even higher. But we've got to come down again. You've got to actually reduce the interaction that people have got. This number of people that are infected on average has got to get down below 1, and that, I think, did require much more stringent actions, what we're all going through at the moment, the lockdown.
So we went through the middle of March, and the government is accused of havering a bit, and they're not sure what to do. They take us then into this, what we could call the loose lockdown on March the 23rd, involving mainly older people. We then have on March the 22nd, this sight of thousands of people on Mount Snowdon, which is the most busy day they've ever had. And on March the 23rd, they said, right, we're going into tight lockdown. And it might well be that when we look back, that's the key date, you think?
I think so, but people were the activity. People were going out on Snowdon, and you had things like the Cheltenham Festival. But people were taking a lot of actions. I remember I stopped shaking hands March the 4th. I did, and people were starting to act before that, there was a lot of distancing going on, and I think that will have had an effect. It clearly did have an effect. But in order to get, really bring the numbers down, which is what we're going to need, or I think we have needed these, what's been going on. But I also should say about the peak, that's the peak in English hospitals. So much more attention is now being paid, quite rightly, to care homes and at home. There's been some amazing data came out yesterday from the Office for National Statistics. Now, in a normal week in March or April, sadly, about 10,000 people die, about 5,000 in hospitals, and about 5,000 in care homes and at home. The week containing April the 8th, when the peaked hospital, when it peaked in hospitals, there were 18,000 deaths reported, about 9,000 at care homes and home, and about 9,000 in hospitals. So, both the hospital deaths and the deaths at home shot up by a huge amount, by 80%. Now, all the extra deaths in the hospital were COVID. The interesting thing are the deaths that happened in care homes and in people at home. Only 1,100 of those extra 4,000 deaths were recorded as COVID on the death certificate. So there's this large number of people who have been dying at home, or in care homes, extra from what we'd normally expect, but have not got COVID on the death certificate. And this is a big mystery that people are now really trying to strike. Yes, because there's lots of reasons why that could be the case.
Well, yes, there's been guesses that people with heart attacks not going to accident and emergency is one.
There's been far fewer people dying in hospitals. In that week, 1,300 people fewer non-COVID cases died in hospitals than usual. Strong suggestion that people aren't going to hospital, because then the deaths are going down in hospitals for non-COVID cases. So the big chunk of that could be people who didn't go to hospital. I think we've all heard stories of elderly people who have been in care homes, had an accident or something, and just, I'm not going to hospital.
Yeah.
I'd rather, they're not safe. I'd rather be here and take my chances here among the people I know, and that seems quite reasonable. So I think that will have happened. And then we've got issues of people who possibly have got the virus, but it's not been so clear. It's not been so many symptoms. So the doctor who has to fill up the death certificate is not happy about putting suspected COVID down when they won't have been tested, and they may not have been seen by a doctor recently either. And that's not a good basis for making a diagnosis. So there are all these issues being looked at, and I think I wouldn't want to wait before I would say that when the peak was in care homes.
And the other problem, I guess, for you as the statistician is that we will see deaths drop for quite a while if this trajectory continues.
Yeah.
But if infections rise when we come out of lockdown, we won't see that immediately in the death figures. Is that right?
No, there's always a delay, and people will be monitoring that very carefully because of this anxiety of second waves. Now, we've got other countries that have been ahead of us, so we can watch what happened to them. One would think that, again, we haven't heard of exactly what policies are in plan to keep us under scrutiny, what surveillance will be done, exactly what will be done once we are, which inevitably will happen, there will be some relaxation in the lockdown. I'm not sure when.
Thank you very much indeed. As always, Professor Sir David Spiegelhalter, statistician at Cambridge University. Also at Cambridge, our favourite virologist, Dr. Chris Smith, lecturer there. And we've checked in with you regularly, Chris, during this whole nightmare. Can I just start with the difficult thought I started with David with, which is that if the peak of infections was before lockdown, could we not have got away with a much looser lockdown?
It's always really, really easy to be wise in retrospect, and the power of the retrospectoscope, as they say in medicine, is a formidable one. I don't think anyone knows for sure what would have happened had we done one thing or the other, because we've never been down this path before. And so it's very, very easy to criticise. It's very, very hard to actually act in a hurry. What results from, or what we've done, as in the we as a country, is to take a safe and as presumed safe as we can be, cautious approach to minimise the ill health and minimise the bad outcomes. We don't know if we've overstepped that. We don't know if we've been overzealous and overcautious and could have got away with less. But if we had done nothing, we almost certainly would have seen a higher peak than we did have. And I think one of the points that David was making is that people had already begun to put in to train their own initiatives to reduce the transmission chain. So it was already probably beginning to bear down on the virus a bit, because we were doing things like not shaking hands so much. We'd already decided not to have some of these mass gatherings and things before they actually became law not to do that.
Out of interest, David said that he stopped shaking hands on March the 4th. Now, I've got a very vivid memory. I went to some radio awards called the Arias on March the 3rd. And I refused to shake everybody's hand, and in the end I gave up because everybody wants to shake hands. So that clearly there was handshaking going on March the 3rd. When did you stop?
I think it was around about that same sort of time when we all realised that. Because I remember watching the Prime Minister on television and other authorities internationally forgetting themselves, having told us all about the transmission risk, and then shaking each other's hands and everyone saying whoops. And so at that point we thought we don't want to be in a whoops moment or a whoops video ourselves, so we all kind of began to toe the line. It would have been around about that time.
I was listening to a podcast a couple of mornings ago in the States, and they mentioned Boris Johnson in a sort of a remote way, and they said, well, there's a guy who shook everyone's hand and ended up in intensive care, and that was their shorthand version of his coronavirus crisis. And maybe that's harsh but fair.
Yeah, I mean, the thing about shaking hands, this virus cannot infect you through the skin of your hands. So shaking someone's hand isn't going to do you any harm. It's what you do with that hand afterwards that could do you harm. Now, if you immediately rush to a sink and wash your hands very carefully, that will be beneficial. You won't have virus on your skin. You've nevertheless, in the course of shaking that person's hand, had to get very close to that person and share air and potentially pick up respiratory infection from them. And if you didn't wash your hands and you put your hands to your eyes, or in your nose or your mouth, or at your lunch with that hand, you could transmit virus to yourself. So it's beyond just the physical contact of shaking a hand. It's the fact that we've all begun to realise that the coughs and sneezes spread diseases, and when we spit and chat all over each other, we also do the same thing. So staying a reasonable distance away is one of the most effective things we can do at the moment.
Can I ask you about what you're seeing in other countries, Chris? I gather in parts of Germany, they're pretty much out of it.
Well, I spoke to an immunologist and dermatologist last night. We were doing a medical webinar to tell doctors and other people about how to manage their patients when they've got coronavirus. And he was in Hamburg. And he said, it's really interesting. I went out around Hamburg today and you would be forgiven for thinking everything was back to normal. And I said, well, why is that? And he said, well, everyone's back in town. The shops are all open. They're still observing social distancing, but people are going about their business. Now, what will happen next? We don't know. I mean, are they going to see a big upsurge? We've seen the same sort of thing happen with Hong Kong and with Singapore, parts of China, where the system kind of relaxed and people went back to their business. They very quickly re-established business as usual, but then we saw the virus come back with a flourish. Now that's what everyone's going to have their eye on. Are we basically just cruising for a second bruising here?
And last question, Chris, is about a vaccine. We were hearing from Matt Hancock, the health secretary, that they were starting, I think he said on Thursday, we're going to try something using the blood of people who've had it and got over it. Now, I don't know, would you take a new vaccine at this stage for anything?
There are a number of initiatives that are going on. One of those initiatives is trying to find drug treatments, and not just new drugs. There are initiatives to repurpose old drugs. It's basically a new life for an old drug. And the idea is that there are some drugs that by pure chance happen to have a side effect that makes them an efficacious weapon against this coronavirus. And there can be a number of reasons why that can happen. People are out looking for those sorts of things. They're also looking for vaccines. And there's something like 140 initiatives that have been rolled out now around the world, and they're focusing on at least 20 different project technologies to make new vaccines. And they're doing this in a hurry. They want to get a vaccine out. The Oxford team, Sarah Gilbert and her colleagues, have said that they're hoping from the Jenner Institute to have something out there by the autumn, and they're saying that they have significant confidence in their technology, and they're going to start making doses of this in advance of these trials being completed, which is encouraging. Their platform, in other words, the techniques they're using are an existing vaccine technology. They're just changing what it educates the immune system to do. But there are lots of other vaccine initiatives out there that are untried and untested, and they're very much more experimental, which is why the timeline has to extend. You need to tread really carefully with this sort of thing, because if we mess around with the immune system, these coronaviruses are quite slippery customers. They're tough cookies to make a vaccine response against, and there is an opportunity to actually make infections worse, not better, when you're vaccinated, suggested, which is it's great that there's all this enthusiasm. It's great that it might just come off, and let's hope it does, but we must be cautious that it might not, and we mustn't bypass important safety measures, and we also need a plan B just in case it doesn't come off.
Thank you very much indeed, as always, for your time, Dr. Chris Smith. His podcast is Naked Scientist, Radio 2 virologist and lecturer at Cambridge University. And before Chris, it was Professor Sir David Spiegelhalter. They know their stuff.